Because of acute comitant esotropia. It is a type of non-accommodating esotropia characterized by sudden onset of large angle esotropia, often associated with diplopia, but comitant in nature. That is, angle of deviation is equal in all directions of gaze in a previously orthotropic individual. Over the recent years, there has been an increased trend in incidence of the acute comitant esotropia from 0.3% to 3.4%, highlighting its growing clinical relevance. There are different types of eyes, like type 1 is Swan type, which is due to the interrupted fusion by monocular occlusion or vision loss. Type 2 is Baryon fractionality caused by the physical or psychological stress and is demonstrated by large angle deviations, small refractive errors, and minimal accommodation. The type 3 is Belchowski type, which is seen in patients with a moderate myopia or might result from excessive near work activities. The type 4 is decompensated strabismus caused by decompensated esophorias. And the type 5 is intracranial diseases, which is caused by the raised intracranial pressure, brain gliomas, and arnochiari malformations, and thalamic or cerebellar tumors. The spontaneous improvement in ACE is unusual, and non-surgical interventions include refractive correction, prisms, patching, and botulinum toxin injections. Even then, surgical intervention is the mainstay of treatment. It tries to study the clinical characteristics of ACE and the various risk factors associated. It is a descriptive study in a sample size of 44 over a period of 1 year in age group of 5 and more years. And we have taken a detailed history, and the visual acuity and the binocular status were documented, and orthopedic evaluation, cycloplegic evaluation, refraction, and the neuroimaging were done. We found that the most of the age group was around 9.9 years, and most of them presented with squinting, with only 5% showed diplopia. And we found that most of the most common refractive error were emetropic with the 27 patients, and suggesting that it can be even without any significant refractive error, and acute comitant esotropia can occur. And myopia patients were 12 in number, and 5 patients had hypermetropia. The average deviation of it for distance was around 33.6 prism diopter, and for near was around 33 prism diopter. And most of them showed fusion, and the mean stereopsis score was around 88. And most of the study population were reported to have prolonged screen time of over more than 5 hours, with and 18 patients showed we couldn't find out any reason, and 6.8% had underlying neurological causes. And among the neurological causes, we found that one patient had post-traumatic subdural hemorrhage, and one patient post-Guillain-Barré syndrome, and one patient had myasthenia gravis. And the distribution of ACE was 66% patients belongs to Baryon type, and 6.8% belong to neurological causes, and 27 patients belongs to Belchowski type. And the study sample was comparable among all the studies. Sample size was comparable, and we found that most of the people had emetropic in our study, and the average comparing to the Kai et al. And Su et al. Study, my study population had a good stereo acuity, and maybe because of the earlier presentation, and most of the patients had screen time as a risk factor. The post-COVID era had more early age of digital exposure, maybe the reason for the upward trend in ACE for the recent years. And to conclude, excessive screen time is a leading risk factor, especially during the COVID and post-COVID era, and it can present as a large angle esotropia in young patients, and neurological evaluation is mandatory. Early recognition and prompt management is a key to good binocular outcome in acute comitant esotropias. So the take-home message is screen time management should be a priority in public health education, and especially for children, and we should encourage outdoor activities and distance vision to balance the near stress. Early diagnosis and early alignment will guide in better binocular vision. These are my references. Thank you. We counsel the parents and to prevent limit the screen time, and most of the patient had good postoperatively good outcomes, sir.
My point is related to that only. You cannot use the term acute for users of for those screen time patients who develop esotropia. I doubt they will develop it acutely. Acutely should be for neurological causes only. Sudden onset, right? Within
Yes.
1 day there is palsy and they develop esotropia. So you can modify your title. Factors of acquired comitant esotropia. Maybe that may be the proper title. Otherwise, it's a good presentation. Thank you. The question is,
This
can
patient,
neurological be committed? Ma'am is asking.
yes, ma'am. Because in this patient, we found that maybe because of the decompensated esophagia due to this illness, maybe the reason for the committed nature in these patients. We couldn't find out any nerve palsies in this patient. Like the EOM was full in these three patients.